Today, we're tackling a pretty chilling reality, a diagnosis that almost always gets falsely blamed on just getting older. We're talking about a hidden dementia risk, and it's silently affecting families everywhere. You know the story. Someone who's been incredibly sharp their entire life suddenly starts losing the thread. They forget names, they miss appointments, they get turned around on a drive they've made 1,000 times. And everyone around them just nods and says, well, they're just getting old. But what if it's not age? What if it's actually a medication?
The absolute crucial point here is that we have to catch this before it's too late, because once irreversible ground is lost in the brain, it is incredibly hard to get it back. So often, the real culprit is just a little bottle sitting quietly on the bathroom shelf, something patients were promised was completely safe, doctors prescribe them, pharmacies fill them, and patients take them day after day. But as we're about to see, modern research keeps proving that completely ordinary, everyday classes of drugs can tank your memory and your learning capacity inside of a single year.
What we're about to uncover gets heavily overlooked, but please don't ignore this. The everyday items sitting in your medicine cabinet right now could be messing with your cognitive health in ways you probably never imagined. And the craziest part? Most people taking these medications have absolutely zero idea that it's even happening. So today, we're going to walk through the medications most closely tied to rapid memory loss. We'll count down from the ones that just get quietly overlooked all the way to the one that is arguably the most destructive of them all.
Think about this for a second. Every 66 seconds, another senior in this country is diagnosed with dementia. By the time you finish this explainer, dozens of families will have heard those devastating words. But for a really significant chunk of them, the root cause was never their age and it wasn't their genetics. It was medication-induced cognitive decline. So, to understand exactly how a simple pill can literally mimic Alzheimer's disease, we've got to understand the nuts and bolts of how your brain actually stores information.
Before we launch into our countdown, we really need to nail down one specific medical term: anticholinergic. I know, it's a massive word, but it's actually a super simple concept. Basically, these drugs block a vital brain chemical called acetylcholine. You can think of acetylcholine as the messenger your brain relies on to lay down a brand new memory and honestly just to stay alert during the day. Now, as we get older, our brains naturally make less of it, meaning we lean heavily on every last drop we've got. When an anticholinergic drug blocks it, it actively starves the hippocampus. That's the little seahorse-shaped part of your brain where all your memories are formed.
Section 1. Your medicine cabinet. These are the threats hiding right in plain sight.
What's wild about this first group of threats is that they're totally ordinary drugs. Most of us assume they're completely harmless just because they're everywhere, and hey, some you don't even need a prescription for. Let's look at numbers 9, 8, and 7 on our countdown. Coming in at number 9, we've got diphenhydramine. You probably know it as Benadryl. It's that little pink pill folks pop for allergies or to help them sleep. And number 8, proton pump inhibitors, or PPIs, like Prilosec and Nexium for heartburn. And at number 7, oxybutynin, sold as Ditropan, which is used for overactive bladders. Sure, they solve immediate discomforts, but beneath the surface, they are actively blocking crucial brain chemicals or flat out starving your neurons of vital nutrients.
Let's break down the real impact of that little pink allergy pill. A 2023 paper in the Journal of Geriatric Cognitive Health revealed something shocking. Older adults who regularly take anticholinergics like Benadryl have a staggering 54% higher risk of developing dementia compared to people who don't take them. I mean, that is more than half again the normal risk, all from something most of us basically treat like candy. If you take it to help you sleep, or if you use any of those PM or nighttime medicines, there's a really good chance you're taking Benadryl under a different name.
And this exact same silent starvation happens when you take stomach acid reducers for a long time. A 2016 JAMA Neurology study found that regular PPI users had a 44% higher dementia risk. Why? Well, it turns out your stomach actually needs acid to pull nutrients like vitamin B12, magnesium, and calcium out of the food you eat. If you turn that acid down for years on end, your brain's wiring just starves. The neurons start misfiring, and that causes confusion and memory slips that look exactly like early Alzheimer's.
Moving right along to number 7, the bladder drugs like oxybutynin.
A 2019 British Medical Journal study showed that taking these heavy-duty anticholinergics for more than a year raised dementia risk by close to 1 in 2, or 49%. This drug easily slips past the blood-brain barrier and just parks itself right in the exact spot where your memories are made. Patients start forgetting appointments, losing their keys, totally dropping out of conversations, and everyone just blames it on age. They rarely trace it back to the prescription.
Section 2. Could this pill be causing the fog? Let's step up to the heavier stuff.
Now, as we get into the territory of heavy, daily prescriptions, I want to be incredibly clear about something. These medications have valid and sometimes absolutely life-saving medical uses. Please, never just abruptly stop taking them without talking to your doctor. Okay, continuing our countdown with numbers 6 through 2. We've got cholesterol-lowering statins, sedating benzodiazepines for anxiety, amitriptyline, which is an older antidepressant carrying a massive anticholinergic burden, paroxetine, a really unique SSRI outlier that blocks acetylcholine, and finally, antipsychotics, which sadly get handed out off-label to seniors way too often just for sleep or restlessness.
Let's look closely at statins. Your brain is made up of close to 60% fat, right? And it actually uses cholesterol to build myelin. That's the insulation wrapped around every nerve that keeps your brain signals fast and sharp. Well, a 2023 study in Frontiers in Aging Neuroscience found that highly penetrative statins can leave the brain short on those raw materials. The result? A 26% higher rate of mild cognitive impairment over 3 years. Patients describe these really frightening blank moments, like driving a totally familiar route and suddenly not recognizing a thing.
With benzodiazepines, drugs you probably know as Valium or Xanax, the picture is pretty concerning too. A 2022 BMJ study found that seniors using them for longer than 3 months had a 51% higher risk of Alzheimer's. What's happening is these drugs are creating a slow chemical sedation across the entire brain by boosting a neurotransmitter called GABA. Learning slows way down, mental flexibility drops, and people often report feeling just emotionally flat, like they're walking through a dense fog all day.
But honestly, the most concerning thing on this part of the list? Antipsychotics being used off-label. A 2022 Lancet Healthy Longevity study showed that seniors who were given these just to manage behavioral symptoms were 71% more likely to experience worsening cognitive decline within just 1 year. These drugs violently suppress dopamine, which drastically slows down the brain and makes it way less responsive. It's heartbreaking because families end up grieving the gradual disappearance of a loved one who is still physically sitting right in front of them.
Section 3, Memory Warning. We have officially arrived at the #1 threat on our list.
Now, what we're about to discuss isn't a single pill. It's actually about how the entire system of modern medicine often fails older adults by treating symptoms in complete isolation. So, what is the biggest threat? You're probably sitting there waiting for one final villain, right? One ultimate worst medication that you could just toss in the trash and be safe. But the reality of medication-induced memory loss is way more subtle than that, and it is happening in millions of homes as we speak.
Your memory is at risk, but not necessarily from one bad apple. It's actually from the slow, completely unchecked accumulation of multiple medications being taken together over time. It's the cumulative weight of all these different prescriptions that ultimately breaks the camel's back.
The official medical term for this is polypharmacy. It just means taking a lot of medications at the exact same time. But the real hidden danger here lies in what's called the anticholinergic burden. Picture a senior taking Benadryl to help them sleep, oxybutynin for their bladder, and amitriptyline for some nerve pain. Looking at them individually, a doctor might think, sure, that dose is fine. But nobody is calculating the total combined burden. That person's brain is being starved of memory-making chemicals from 3 completely different directions, all at the exact same time.
The numbers on this are just absolutely terrifying. A 2022 Age and Aging study tracked over 280,000 older adults. They found that the folks with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years. 120%. That is more than double the risk. And the overwhelming majority of these patients, they had absolutely no clue. When acetylcholinergic is blocked this aggressively, the neurons literally weaken from underuse, the connections shrink,
And the brain basically settles into this underpowered state that mimics Alzheimer's perfectly.
Section 4. Check your meds. Because this is where you take your power back.
Look, here is the absolute most hopeful part of this entire explainer. You do not have to just sit back and accept this fog as normal aging. Medication-induced cognitive decline is very often completely reversible as long as the source of the harm is identified and either reduced or removed early on. So take a deep breath. The human brain is remarkably resilient. We see people regain their clarity, their energy, and their memory within just weeks or months of properly adjusting their prescriptions.
So here's your game plan. Step 1, never ever stop taking these drugs abruptly on your own. Some of these withdrawals can be really dangerous. Step 2, add up your total anticholinergic burden by checking out all your prescriptions and those over-the-counter bottles. Step 3, talk to your doctor or your pharmacist. Ask them for a careful medication review. There are almost always gentler alternatives out there. Maybe it's changing a heavy sleep aid to a low-dose melatonin or switching a bladder med to one that uses a completely different chemical pathway. You have options.
Now, your medicine cabinet is one place your body hides its warnings, for sure, but it is definitely not the only one. Did you know your hands are another? Seriously, your fingernails can reveal silent threats to your kidneys, your blood, and your nervous system years before any other symptoms even pop up. Most people never learn what to look for, but we are going to decode exactly what your nails are trying to tell you in our next explainer. Trust me, you won't want to miss it.